This program is brought to you by SAMCEDA, the San Mateo County Economic Development Association.
Why should you invest the next 20 to 30 minutes of your time in watching? Have you ever wondered about the people and purpose behind various businesses on the peninsula and Silicon Valley? Who works there? Why? What do these companies and organizations really contribute to our communities? If you are even a little bit curious, take a moment and hear their stories and why business is more than the bottom line. For 7 decades, the San Mateo County Economic Development Association, better known as SAMCEDA, has championed the business community by convening and connecting them to the communities in which they make their home. People hear about Genentech and Oracle, but do they know about Design Tech High School and Future Labs? My guess is no. So we are going to tell these stories and many more. The stories of your friends and neighbors who work there and how they contribute and collaborate through their employers with our food banks, our schools, our youth sports teams, our art and cultural groups, our veterans and our seniors. How their companies give back and believe in more than the bottom line. On today's show, we have Carla Boragno, Senior Vice President, Global Head of Engineering and Facilities, Roche Genentech, and Bill Graham, President of Dignity Health Sequoia Hospital. Welcome to More Than the Bottom Line. I'm Rosanne Foust, your host. With me today is Carla Boragno, Senior Vice President, Global Head of Engineering and Facilities, Roche Genentech. Welcome, Carla. It's so good to have you here.
Great to be here, Rosanne. Thanks for having me.
So Genentech is an amazing company.
Yeah, I think so.
You have an amazing history with the company and with South San Francisco. Could you share it with us,
Sure,
please?
sure. Well, I'll actually start with a little bit about my background. So I actually am a longtime native of San Mateo County. So I grew up in Millbrae, went to Cappuccino High School, and then my time out of San Mateo County is when I was at school at Cal. But my first job out of college was at Genentech, right in South San Francisco. And what was really sort of unique and coincidental for me is that growing up, my dad worked at Bethlehem Steel. And so here, when I started my job in 1986 at Genentech, I was like driving to work the same way my dad used to go to work.
I get goosebumps.
Yeah,
I mean,
fun.
that is, and to see where the campus is today,
Yeah.
and its awards for sustainability and how Genentech has truly embedded itself in the community.
Yeah.
Share with us some of those stories and experiences, and you just have so much.
Yeah. So Genentech, we're all about discovering and developing really important medicines for patients. And our medicines, we've got things for cancer, medicines for cancer and multiple sclerosis. And we're an innovation company. And what we like to do in the part of the business that I'm involved with is we like to take that same scientific, innovative approach and apply it to how we operate the campus, how we build our buildings. And so what's important to us is thinking about how we can really have a positive impact on the environment because of our footprint. And so we do a lot of work in the built environment around environmental sustainability, around looking at ways that we can reduce our CO2 emissions. In fact, just last year, we opened up our first net zero energy building. So this is a building, it's a child care center, so for about 350 kids. And that building actually generates more electricity than it consumes.
That's incredible. I mean, there aren't a lot of companies who are doing the work that you're doing. And I know that we're going to show a video on resiliency and on the built environment and how the environment is impacted. So that'll be something that we'll show in a little bit. But share with us, what made Genentech go down that path?
So we have deep roots in South San Francisco. So we're so proud to call South San Francisco home for the 40 plus years that we've been in business. And we feel really strongly that we want to be an integral part of the community. And if we want to be an integral part of the community, then we believe it's important to give back in many different ways. And one of them is by engaging with the local community. In fact, we have a program called Future Lab, and this is a STEM education program. It's hyper-local. It's a private-public partnership with the South San Francisco Unified School District, and it's a program where we really want to get kids excited about pursuing education in STEM fields. And in science, it takes about 20 years to get a medicine from discovery all the way out the door to the patient. And if you think about a student, from the time that they're starting kindergarten all the way through high school and college, it's about the same. And what we really want to do is grow like the next scientists and the next engineers. And this program has a couple different parts. So with the elementary school, from 3rd to 5th grade, we actually have one-to-one mentoring of students. And our employees actually volunteer their time to work with the students on their homework assignments and start getting them thinking about science. And then in 8th grade, for the 8th graders, we actually have a science competition. It's called the Helix Cup, and it's through all of the 8th graders. It's a fun competition, and it's hands-on experimentation and things of that sort. They come to camp. The winners from the different schools come to campus. And then at the high school, we have something called the Science Garage. And this is a facility that we actually built for the high school, for South San Francisco High School. The kids from El Camino as well can use it. And there's a curriculum, a biotech curriculum. And the kids that go through the biotech curriculum actually will earn credits towards meeting their requirements for the UC and the California State schools.
That Science Garage is phenomenal. I was there at the groundbreaking. I couldn't have been more proud of the company, even though I don't work there. So we're going to come back and talk a little bit more about the Science Garage and your role as a mentor, because you're an incredible mentor to a number of not only employees, but people in the community. So we'll be right back to More Than the Bottom Line. Welcome back to More Than the Bottom Line. With me today is Carla Boragno, who is the Vice President of Site Services with Genentech. Carla, it's great to have you here today. And before the break, we were talking about the Science Garage. So could you share, that was a very big deal because you worked hand in hand with the school district. So could you describe it?
We did, yeah. It was a wonderful partnership between Genentech and the South San Francisco School District. So the administrators, the teachers, and the community. And one of the things that I'm really proud of is the actual physical structure, the laboratory building. Folks in my organization actually volunteered their time to actually manage the design and construction project. And it was about $8.5 million. And we made time available for them to do this, and they were so proud to be able to give their time and their skills and energy on something that's really going to help and support the school district as well as the students.
Well, and the children, when I was there for the groundbreaking, the high school students looked amazed and so excited, and the Genentech employees looked so excited. So understanding how that all worked together is just fantastic. You're also doing work in the field of resiliency. Yes. With youth. And could you share that with us? And what we're going to do is we're going to show a short video on Genentech and the work they're doing in resiliency. And Carla is going to share with us a little bit about what that video means.
There is no way that I can see that glow that a child has and not respect the immense amount of resiliency that is innate in children.
I really try to encourage Amari to follow his dreams. He talks often about wanting to be an engineer, but there's a lot of challenges in living in this community. When there are shootings, his heart is racing, he's very scared, and he doesn't want to leave my side. I worry about my son's physical and mental health from the environment that we're in all the time.
It's been about 25 years that I've worked in these communities. Trauma often remains invisible or unsayable. but we know from science that it's highly prevalent.
Listen back here, okay? Can you breathe big? Good. I see every day in clinic kids coming in for asthma, obesity, mental health, behavioral issues. And traditionally, we've treated those symptoms. We've refilled the medicines. What we've learned is that the root cause of many of these diseases is actually what's happening early on in the home of the child, in the neighborhood, in the school. It's abuse, it's neglect, it's household dysfunction, it's experiencing violence and discrimination.
Research has shown that stressful or traumatic experiences in childhood can lead to activation of a prolonged stress response. For a person who has 4 or more adverse childhood experiences, we are talking about double the risk of heart disease, 2.5 times the risk of stroke, double the risk for cancer, 11 times the risk of Alzheimer's.
There are millions of children affected nationwide by adverse childhood experience. Everybody needs to know about trauma, just like you would about any kind of disease. In my opinion, trauma is the public health issue of our time.
When we know what's going on, we can use that science to interrupt the process. It starts with early detection, screening every kid, and then using the best practices of what we currently have evidence for. Things like team-based care, integrated primary care and behavioral health.
It's really essential that we help families to understand the science of early childhood adversity and how that plays out into families' everyday activities.
Relationships heal. So the more that we can create healing in the lives of adults, the more healing children will have.
We have an important opportunity to impact the health of our next generation's children.
It will take individual, family, community, science, social workers together to be able to make this happen.
The big vision is that all children can thrive. Resiliency is everywhere. We just have to tap into it.
So when you think about childhood trauma, we were really moved to start thinking about how might we be able to help with this. We're a healthcare company, and so we've come to understand that 45% of California residents experience some sort of childhood trauma in their early years, and we know now that this 45%, and there's research out there that shows that childhood trauma actually leads to serious health issues later down the road and later in life. And so what we wanted to do is see how might we be able to bend the needle on that. And so we are focusing efforts to fund, to convene, and to foster collaboration with key stakeholders in this space in the Bay Area through pediatric health centers as well as local communities.
That's incredible. And when you think about those statistics, 45%, I mean, that is a scary statistic. And so I think it's wonderful that we're able, through More Than the Bottom Line, to showcase what companies like Genentech are doing. And with all of your environmental sustainability work, you also have a very good relationship with the city of South San Francisco. Can you share with us about, I believe there's something called Genentech Days?
Oh, that's Genentech Goes to Town. Yes, yeah, and that's we've been doing this for years and years and years at the company, and it's a program where we actually can support the local businesses. But stepping back, we've been in South San Francisco for over 40 years, and we believe that it's really important to have that strong partnership, not only with the city, but as well with the local community. And we want to be a force for good in the community. We have a strong partnership. And we feel that it's important for businesses to partner with the city and to help tackle some pretty tough issues. You know, right now we all know what's going on with transportation and housing, and we want to be part of the solution. And we actually want to partner with the city officials and the community to think about different ways that we can address those issues.
And you have been a leading company on transportation, on the housing discussion, and I know you encourage other companies to do that, but if there was one message you would like to give, not only biotech firms, but other companies, what would you say to them about their engagement with local communities?
Yeah, it has to be done. You know, we're a strong believer that businesses have a unique voice and a unique role to play in these community issues. We can't solve them by ourselves. It's not our place to solve them by ourselves, but I think it's important for us to bring our skills, our energy, and our commitment to the table with the community stakeholders and with the local cities that we are in and that we reside in.
Carla, I want to thank you so much for being with us here today. Genentech is a 40-plus year company in San Mateo County, and having it as a part of our community, we are very, very fortunate. So thank you for being with us here today.
Thank you for having me.
Welcome back to More Than the Bottom Line. I'm Rosanne Foust, your host, and with me today is Bill Graham, the president of Sequoia Hospital Dignity Health. Welcome, Bill. So glad you're here.
Thank you. Glad to be here.
So what we want to talk about today is Sequoia Hospital, its long history in the community. But first, could we get your background? Tell us about yourself.
Sure. I grew up in Sacramento and lived there until I came to the Bay Area and attended college at Santa Clara University. And that kind of got me connected to the Bay Area. I really enjoyed it. And when I had an opportunity to start my career right here in San Mateo County, I jumped on it and have been here ever since.
And your Sequoia Hospital is such a unique community member. It has been around for over 50 years.
Yeah.
And so tell us about, because the whole premise, as you know, of the show is more than the bottom line.
Right.
And Sequoia Hospital really represents that.
Yeah.
So give us a flavor.
Yeah. So Sequoia Hospital, it's a really unique story. We were actually first envisioned in the late 1930s. And if you think about that time, all these communities were small little communities. There were still cow pastures in the area. Actually, Sequoia Hospital was built on a former cow pasture. And there was a group of visionary women led by Dove Beeger who recognized that as the community was growing, we were going to need strong healthcare, high-quality healthcare in our community. So they led the effort over a period of 15 years to fund and build Sequoia Hospital. And in doing that, they created what was the first special hospital district in California. And what that meant was the taxpayers in the community said, we value healthcare, we think it's important, and so we're going to have a portion of our property taxes allocated to the building and funding and management of the hospital. And so our origins have been in the community from the very beginning. And it's kind of fun for me. You go back and look at some of the original documents. The original CEO, Max Gerfen, he was so focused on we are for the community, we're here for our friends, our family, our neighbors. That's what we're about. We need to make a profit because that's how we sustain the business, but when somebody comes in, they should have every assurance that it's about quality and the experience that they have here. And you know, that was in 1950. We're still talking about that today in 2018, 2019. So it's really remarkable to see that that was really kind of the visionary thinking back then.
And there's been so many changes at the hospital, with community hospitals, with healthcare districts. And can you tell the audience a little bit about some of those?
Yeah, healthcare has changed quite a bit, even in the time that I've been in healthcare. So when I began my career, most hospitals were still independent, or they were small systems, you know, a couple of hospitals. Sequoia back in the mid-90s was really finding that being independent was a significant challenge. And by 1996, the hospital was struggling financially and really wasn't able to bring together the resources in order to be successful. So at that time, we aligned with Catholic Healthcare West, which is now Dignity Health. And I think the thing that was really valuable for us in that is that brought us together with a network of what is now, I think, 40 hospitals. And it allowed us to be part of an organization that valued the same commitment to community in all of the communities that we work in. And it brought together expertise and skills, electronic health records, the ability to purchase supplies and materials together, the ability to work together on quality. As a company, we're all working on the same quality goals every year. And that's a pretty remarkable thing, and it's a great way for us to demonstrate to our community that we're committed to the care that they receive.
Well, it absolutely is, and I think that your embedded mentality in the community, because you're involved in a number of nonprofit associations. Your relationship with SAMCEDA, we are very grateful about. Would you like to touch on that?
Yeah, I love being part of SAMCEDA. We're also very involved in the chamber. The Redwood City Chamber. I think the value that has for us is it allows us to connect with business leaders in our community, as well as government leaders, representatives of other not-for-profits in the community. It helps us understand what some of the key areas of focus are, the key challenges that we're all struggling with. I've been really pleased in particular with the leadership that SAMCEDA has taken and the Chamber and others in housing, because when we look at our workforce, we know the biggest challenge that we have is probably the ability of our staff to live in San Mateo County. And as a resident of San Mateo County, I want those healthcare workers right here if I need them in an emergency.
I think it's so important. And when we come back, we're going to take a short break. I'd love for you to share with us about your mentoring, because I know you are a tremendous mentor. You've been one to me, so we'd like to hear more about it. We'll be right back to More Than the Bottom Line. Welcome back to More Than the Bottom Line. I'm your host today, Rosanne Foust. With me is Bill Graham, the president of Sequoia Hospital, Dignity Health. Welcome back, Bill. We're so glad you could join us today. And right before the break, we started to talk about mentoring. And in your role as the president of the hospital, you do a lot of mentoring. I know you're community mentoring, but could you just touch on what's important when you're mentoring?
I think the first thing with mentoring is to recognize where you've gotten your own mentoring, the things that have been impactful for you. So for me, I've had the opportunity to work with a number of people who have either purposefully mentored me or just been examples, people that I've looked to say, okay, how have they handled these kinds of situations? What can I learn from their experience? And through that, what I think I've learned is that one is mentoring is really dependent on open dialogue. There has to be an honesty and an openness in the communication, the ability to share where you're a little bit vulnerable, and the ability to ask for help, and then the ability to create a relationship that lets people do that. And the other thing that somebody taught me a long time ago is focus on the things that you do well. I think there's always this tendency to say, okay, these are my weak spots. I've got to fix that. And yes, those are things you probably need to be focused on, but we all like to do the things that we're successful with. We like to have those wins. And so whenever I'm working with somebody individually in particular, the first thing I want to find out is, what are you really excited about? What are the things that you like doing? Where do you feel that you have wins? And let's focus on how we can ramp that up. And then, there are other pieces will come and follow along with that. And as a mentor, I think one of the things I learned too is that I probably learn more from people I'm mentoring than they realize.
Well, and I think that style, that open dialogue, really served Sequoia Hospital very well when you were building the new pavilion.
Yeah.
Because being active in the community, you were there. You were a part of the leadership team. And the way you embraced the community and had the community actually step by step with you on the process. Could you comment on how that worked as a community engagement strategy?
Yeah, and actually, it's almost hard to call it a strategy, but it really is. At the very beginning of that process, when we began to envision the pavilion and whether or not that was going to be on our current campus or a different location, which I think people have forgotten that was part of the discussion initially, we knew that we had to engage the community. We had to find out, what is it that you want from us? You know, this is something we have to do. It's being driven by regulatory guidelines, but we want to make sure that the decisions we make today are things that the community can be comfortable with, 20, 30, 40 years down the road, and ultimately that we're providing that care that we had committed to back in 1950. So community engagement, talking with our neighbors, talking with the larger community has always been a big, big part of what we do.
You did a fabulous job with that. I mean, I remember being at the opening of the new pavilion, and I think the quality of care at Sequoia is amazing. Mm-hmm. Your whole women's section for women's health issues, as well as you're a leading institute for heart and heart surgeries.
Right.
And so could you touch on some of the different areas within Sequoia that you're known for?
Yeah, you mentioned a couple of them. I always like to start with the emergency room. I think that we hear so often from our neighbors, everybody around us, that the emergency room is a phenomenal place when you need that level of care. And we have just consistently, year over year, I think, provided great care in our emergency room.
We been there.
Yeah, a lot of people have been there. I've been there. It was kind of fun as the president of the hospital to walk in with a broken wrist. And I got phenomenal care. We're very well known for our obstetrics program. I think 5 or 6 years in a row we've been, probably even longer, named the best place to have a baby from Bay Area Parent on the peninsula. Phenomenal cardiovascular program, really a nationally recognized program in interventional cardiology, electrophysiology, which is the rhythm of the heart, how your heart beats, and then our heart surgery work. So we're really excited and proud of the work that they do there. We do over 1,000 total joint surgeries a year now, so our physicians are just phenomenal, have an excellent reputation. We're one of the largest total joint programs in the Bay Area at this point. So we continue to grow and look for new opportunities and partner with our physicians to bring really exceptional high-quality care to the peninsula.
You do a great job. You're literally located in my backyard, so I love that. One final thought that you would share with other companies, organizations about community. What would you leave them with?
I think it comes back to what we talked about at the very beginning, is that we are an employer. We are in the community, and we are very dependent on the resources of the community around us. It's important that we give back to our community and that we recognize what it means for us to be a neighbor. And I think that sometimes it's easy to get very internally focused, and you have to step out sometimes and say, okay, what's going on in the world around me? What's impacting the people who live and work in this community that I'm a part of, and how can I be a part of it?
Bill, I want to thank you for joining us today on More Than the Bottom Line. Sure. It's been wonderful. I know so much about Sequoia, but I just love having you here, so thank you. Thank you for joining us on today's More Than the Bottom Line.
This program is brought to you by SAMCEDA, the San Mateo County Economic Development Association.